All right. Well, welcome to our State Technical Assistance webinar, Top Trends Driving Public Health Communications in 2026. I'm Claire Grace Jones. I go by Claire Grace. I'm here from CSN, from the Children's Safety Learning Collaborative. We are very excited about this STAW today, so we are going to jump right in. Just a reminder, so these STAWs or State Technical Assistance webinars are brought to you as part of our Child Safety Learning Collaborative. We're going to share a little bit of information at the end that if you are not already part of our Learning Collaborative, there will be an opportunity coming up soon for you to join. But also just a reminder, this is just one of the things that we do at CSN. We also facilitate the Children's Safety Now Alliance. We offer training and technical assistance, both on events for lots of folks like this, as well as individualized assistance. There's a button on our website. You can reach out to us anytime. We're happy to help, whether you are in our collaborative or not, whether you're a Title V agency or not. We are absolutely happy to provide support. And we do things like this, offering webinars and resources. Of course, we want to acknowledge our funding sponsor. We are very grateful to HRSA for their funding and their support of our project. And of course, reminder that anything that we say should not be construed as their support of anything we say, basically. But we really appreciate their support of this project. So just a moment to talk about engagement. Again, what I love about the STAWs is they're not sort of a typical, webinar. We've got some great content for you today, but we really want these to be dynamic and engaging. The more questions you ask, the more you share your own examples. Even, I'm a big fan of, even if the one of us says something and you say, oh, I don't know that would work where I live, here's why. We want to hear that too. And so please feel free throughout. Katrina, who I'm going to introduce in a minute, is our speaker today, and she is also incredibly flexible. No need to hold your questions to the end. So if you want to unmute at any point, please feel free to unmute and to ask or to throw in an example. Please use the chat throughout. We do ask that you stay muted when you're not speaking just because it preserves the audio quality. And this will be we're recording, and we will have this posted on CSN's webpage, and the recording and the materials will be available to you after the stop. And then if you would, we'd love it if you would rename yourself. If you go either in the little corner of your video or you go to the participant menu, you can pull up the little menu that says rename. We'd love if you put the name abbreviation for your state right after your name, because there might be some of you who are doing similar work in a state and don't actually have a connection yet. So this could be an opportunity to do that. Or somebody might share something on the webinar that you're interested in following up on, and it'll make it easier for you to find them after the webinar. I think I've covered, and then we're going to closed captions can be viewed by using the closed caption button, and we will try as much as possible to provide verbal summaries of what's on the slides and what is in the chat. Just briefly, our community guidelines. We really just want you to focus on being present. I just was sharing, though, we understand it is school vacation week here in Massachusetts, so I have somebody home in the other room. We get that sometimes things are going on, so you may not be able to have your video, but as much as you're able to be present, I know in the midst of a lot of busyness, it's hard with competing tasks, but would love for you to try to be here, bring a curious stance, be partners in learning. Our motto in the CSLC is all teach, all learn. Everybody has something to contribute from their experience and their context. So we want folks to honor each other's perspectives and experiences and learning styles. And then, as I said, certainly take care of yourself as needed. So our agenda is pretty much that we are going to get to hear from Katrina today, which I am very excited about. She is the co-host of the Communications Breakdown podcast, and then we'll make sure we have time for questions and discussion, or we may just kind of have that all throughout. And at the end, please make sure that you stay on, because we will have a few things that are upcoming. We want to make sure we capture your thoughts in our evaluation. That is our agenda. And before I introduce Katrina, we would love to do a brief poll that Jenny is going to bring up just to see who is in the room. Okay, we've got Yep. Okay, great. They're coming in now. We've got a couple people. If you are having trouble with the poll, please, you can also feel free to share in the chat. I know sometimes, like if you're on a mobile device or something, it might be a little tricky. Um, Great. So we've got about half of the folks. I'll give it another minute. Thanks to everybody who's also introduced themselves in the chat. Thanks, Teresa, for the like for our All Teach, All Learn. This is great. All right. Well, almost 90% of people have participated. So I'm going to go ahead and end the poll. And if you all are interested, I'm going to share the results. It looks like we've got a few folks that are either from a clinical program or a hospital, some juvenile justice, other government agencies, professional associations, some nonprofits, and others. So thank you so much. But now with whoops, I think I hit, okay, I hit stop sharing. You all can't see the poll anymore, right? Okay, great. All right. Without further ado, oh, I'm sorry. We have one more chat. So as we get started thinking about who's in the room, we would love to know if you want to share in the chat or you can take a second to unmute and share. We'd love to know what role do you specifically play in public health communications? So are you someone that's creating media, that's sharing media? Are you creating something that someone else is then kind of polishing and branding to be shared? What role do you play in public health communications? You can share in the chat. You can unmute. Okay. Oh, thanks, Jessica. Jessica says creating media for internal review and then sharing. And if you want to share if it's helpful, is this social media? Is this, print media? Is it flyers? All kinds of media. Thanks, Erica. Content framing, sharing, offering updates regularly to local media with clips on injury prevention. And they have a Facebook page from Teresa in North Dakota. Thanks, Teresa. Creating social media awareness newsletters, infographics, and reports. Thanks, LaDonna. Creating in multiple formats, information for people with elevated levels of heavy metals. Oh, interesting, Anna. Thank you for sharing that. All right. So, as usual, those of us who work in public health wear a lot of hats. It sounds like you all do a lot of different things. So, thank you. Feel free to keep the chat coming. But I am going to go ahead and introduce today's presenter. So, Katrina Boylan is a senior research writer at the Center for Injury Research and Policy at Nationwide Children's Hospital. She develops messaging and outreach strategies for child injury prevention campaigns, as well as education and training on public health and research communications. She loves to work with researchers, staff, students, and others to find the best way to reach their communication goals. As co-host and editor of the Communications Breakdown podcast, she brings warmth, humor, and a bit of perfectionist energy to every episode. Katrina has a BA in English from The Ohio State University and a Juris Doctor from Capital University, and she worked in state government, healthcare administration, and private law before coming to Nationwide Children's Hospital. I will also just share, as we were chatting before we got started, she shared that their podcast has now been listened to in 33 different countries. And I will just say that she is a delight. And so I am happy to hand it over to Katrina.
Well, thank you so much, Claire Grace. A lot to live up to there, but I just really appreciate the invitation to come and talk today about some of the things that we talk about kind of all the time on our translational research team at my office. And so, really today, what we're going to talk about is some of the top trends that we've been discussing and that we think are going to be driving health communication this year and probably for the years to come. And so let's talk a little bit about why we're here today. And I think we all know this, right? The pace of basically everything has just sped way, way up. And I know I personally am trying to produce more on a tighter timeline and unfortunately with less support. You know, the way grants have changed and the way things have moved around, we're all wearing all these hats all the time. And so what it means is that I don't have as much time anymore to go in and perfectly craft a message that's going to work on all platforms anymore, or I might not be able to get in there and design something new. And so we're really looking at this going, it's overwhelming, to try to take on all of this at one time. And so as the platforms change, as our needs change, and as what we're being asked to create and do as public health communicators change, we're looking at this going, how do we manage it all? And so, again, we're going to go through some of the things that we're thinking about as we're thinking about what channels we want to be on, the messages we want to create, and ultimately, what's the best return on investment for us so that we can continue to do this work and reach the audiences we're trying to reach. And so, again, we're going to talk about just five things that we're thinking about. And that first one is going to be audience. And I know many of you are already familiar with the concept of audience, but what we're thinking about is a little bit beyond maybe than what we've originally thought about with audience. We're really thinking about who is your audience. As public health professionals, we're not always accustomed to really drilling down and getting into specific audiences, but today's communication really is going to require us to do that. And then the other thing that we're thinking about is where people are. Everybody's on different channels and different platforms, and we're getting our news and information from different sources these days, and we're getting it in different ways as well. Young people might be getting it more from video, older folks might be getting it more from different places. And so we're being asked to do all kinds of different things that I'm sure that, like you, I was not trained for. And so we really think that focusing first on your audience, who they are and where they are, is the best way to approach this. And so when I'm talking about audience, so we can go next slide, please, Claire. When we're talking about audience, I think that in public health, we tend to think, well, the whole public is our audience. And I really am asking us all to go beyond that because there's a couple of things that happen when we don't define our audience before, beyond the general public. And the first one is that we end up with vague messaging. I really think that I don't come from public health. I come from, again, an English background and a law background. And so when I came into public health, I kept seeing things that would say, like, learn more about, learn the risks of such and such. Okay, well, where am I supposed to go to learn those risks? Who am I supposed to listen to? There's just things that are left out that are important for actionable messaging when we do not define who exactly this message is for. And so by getting out of that general public and even getting a little bit further, just one or two steps beyond that, we can help write messaging that gives a more actionable step. And so the next thing that we can do with more accurate messaging is we can talk about the real differences in audiences. The risks are going to be different. Their barriers are going to be different. Their motivations are going to be different. So many things in messaging counts on us being able to make a person feel heard and seen and reflected. We want them to feel like this message is for me, because otherwise they'll tune it out. We've all experienced this. If you think about it, I had an experience a couple of months ago. I was driving down the street towards work and just kind of, listening to music, kind of, in the space you're in when you're in your car. And I went past, it was a safe sleep billboard, but it was in Spanish. And I don't speak Spanish, but I am a public health person. So honestly, anything about safe sleep, I'm going to look at just for the communications perspective. But it's funny, when I was in that kind of, half paying attention state, I saw the Spanish. And even though it was about safe sleep, my mind went past it because that Spanish language indicated that wasn't for me. I don't speak Spanish. We talk about jargon a lot in this field. And honestly, jargon has its place. It can signal credibility in the right places in the right time. But you give it to an audience that doesn't know what that jargon means, and they assume that message isn't for them. And so by narrowing our audience down, we've got a great example here on the side. This is what we tend to do in our office. When we're doing something like medication safety, we don't just talk to parents and caregivers, because let's face it, as child injury professionals, safety professionals, we're always going to be talking to people who are caring for kids and responsible for the care of kids. So when we're doing our campaigns, we really do like to drill it down to who is this message for? And so instead of the general public, it could be parents of kids who are under 5, right? So it's not parents of teenagers who store their medication in the kitchen, because people who store their meds in the kitchen are going to need different advice than people who might store it in a bedroom or a bathroom or somewhere else. And so once we really start to define our audience, we can design messaging and design content that's going to resonate with them more. And so once we've kind of figured out who is in the audience, we also need to know where they are. And so this is where I think, Claire Grace, if you want to go next, we've got the opportunity to really drill down into where our audience is. Um, there's some really great research out of Pew Research Center that shows the breakdown of different demographics and what platforms they are. And again, this is mainly social media, but we really do use that when considering what platforms we're going to use. Our target audiences don't always are not always I guess the final audience in some ways. A lot of the programs that I run are there to support people like you, actually, people who are working in those programs and doing that, directly with children and families. But we ourselves are not doing that. We're helping support you all. And so we're looking at that going, my final audience might be those children and the parents, the families, the caregivers. But ultimately, I need to reach people like you because that's who I'm designing for. So, places like LinkedIn might be a better spot for me to reach other public health professionals than going to, Facebook or something like that. So again, we always want to be checking where our audience is. Do they want this information that I'm providing in the place I'm providing it? And if not, where are they going for this type of information? And we can meet them there. We want to be sure that we're not, again, this is for us, it's a lot about we don't have the time to be everywhere all the time. And so for us, it's about being really clear about who that audience is. So then we can match it with a channel, with some content, so that we make sure that we're not, again, we're getting the most investment and the most effective messaging we can for our time. So that's one thing. Audience is one thing. But once you know your audience, you still have to figure out how to be authentic. And I really think that this is where 2026, I think this is where social media is at, is authenticity. Um, People are really looking for real voices, and we'll talk about why in just a second. But this to me is about how we're going to get their attention. To me, things that are authentic are more likely to gain and hold attention. And so for us, it's we can look at things like influencers and how they're keeping attention, and then we can take what's real about that, what's authentic, and take it and apply it for our roles and our voices. I'm at a hospital. How I talk about car seat safety is not the same as like a mom who's doing kind of outreach and things like that and doing it from that perspective, right? And so I really think we need to be clear about, you know, with your programs, with your roles, what is your job here? And then what is your voice? And it doesn't always mean we have to be the type of thing that is going viral all the time or things like that. We want to stay in a voice that fits with public health. And so this isn't going to look the same though for everybody. And so let's just go through some examples because I really think authenticity can look different from some different places. So my first example here is going to be from Johns Hopkins School of Public Health. And if you are not following the School of Public Health, the JHU School of Public Health, they do some of the best social media I think out there for public health. I think they're absolutely killing it. So one thing that I want to note though is we're going to talk about why this works for them. They've taken, you can see this post. It's a picture of the actor Timothy Chalamet. And if I think I'm right about this, that he has just won some type of award and thanked his girlfriend that he has not maybe previously acknowledged before. And so this was a big event in the public or the pop culture world. And so what Hopkins has done is take this event and adapt the language for flu shots. And so if you can't see it, what it says is that, it's adapted to say, thank you to my flu shot. Thank you for our foundation. I love you. I couldn't do this winter season without you. So that's the way the text is adapted. So they've taken something fun and pop culture, but they've made it witty. They've made it fun. They've made it informative, right? And so that's one way to do this. They've also, I don't know if you can see this in the text, they say, "We heart Timothy Chalamet be schedule your flu shot ASAP already." And so again, they're using humor, they're using pop culture to reinforce a very serious message of get your flu shot. Now, next slide, I'll show you. This is one of our programs. We would not be sharing that meme from Hopkins because that's not the look and feel. That's not what's right for our role and voice for one of our programs. In this program, we're trying to reach a broad audience. We're trying to support public health professionals or virtually anybody that's working with families and kids. And so our voice on this project is it's a little more straightforward. It's friendly though. It's bright and colorful, but it's always informative and it always has a strong take-home message. And so again, those memes are great for places like Hopkins and their role and their voice. But for my program, we want to stick to like, still make it bright and colorful and engaging, but also make it very practical and make it something that can be widely used. So again, just different approaches. As long as you know your voice and your role, you can tailor your content to that. But I think there's a couple of other things that I would mention in authenticity before we move on, and that is that I really want us to also think about, and you can go on to the next slide, Claire, is that I really want to also think about making sure that we're executing this content in a way that makes sense for us. Good example, I am not the best video maker in the world. And so, TikTok, obviously a huge channel, reaches a huge number of people, but I'm not great at video. And I'm honestly not going to probably have the time to learn how to do it well and do it the right way. So I'm not going to be able to execute a TikTok video in a way that's a good investment for me. And so what you can do though is if I needed to be on TikTok, I'm probably going to go find somebody who's already there and doing it well and that's aligned with my mission, my values, and that also respects my voice and my audience. And we're able to work together and do something. I'm here in Columbus, Ohio. Our Columbus Public Health, I think, actually has a great TikTok channel. And so, like, I might be able to go to them and say, could you share this information and reach the audience that way? I will also say I do also like to look at other people's accounts. I told you I like looking at that Hopkins account, but sometimes it's for inspiration of who I'm not. It's to remind myself of who I'm not. I'm sure all of you are familiar with Consumer Product Safety Commission's social media presence and how that's changed over the years. Another one, I'm in Ohio again. The Northeast Ohio Sewer District is doing a amazing job on their social media, blending who knew infrastructure management with a heartwarming emotional support. I mean, they're doing a great job. And then there's another one that I want to talk about, which is the Washington Department of Transportation. And Claire Grace, we can go to the next slide. This is an incredibly popular account. They do huge numbers on their social media. But I want to talk about why this is right for the Washington State Department of Transportation. But here in Ohio, I would never use this. And that is because, so up in this top right corner is something called a gooey duck clam. And had I not watched Top Chef Seattle, I might not have known that that is a gooey duck clam. But I do. And for apparently the Pacific Northwest, this is a common animal. This is something that's very familiar. But I will tell you here in Ohio, it is not. And so this works really, really well for the Washington Department of Transportation. But again, here in Ohio, you can use that same fun, whimsical attitude, but you want to tailor it for your region, right? So again, this is a Washington Department. They've really made a name for themselves doing these kind of hand-drawn but informative drawings. And then they've also got some stuff that in there that's just really heartwarming. And so if you want another example of how you can use social media to share serious information, but in a way that is regionally appropriate and will get your audience's attention, again, authentic for them, but is not going to probably fit here in Ohio. All right.
Katrina,
So,
before you before you
yep,
move on to the next section,
yep.
I just wanted to draw attention. Crystal had put a comment when you were talking about kind of thinking about general audience versus like a more focused population, and you were talking about, seeing a billboard that was in Spanish, and in your
Mhm.
brain, it was like, oh, that message isn't intended for me as an audience. Crystal just had, talked about that, Spanish people are part of the general population. And so I wondered if you want to, and I shared a little bit in the chat saying, it's more about talking about a focused population, like we want to reach suburban moms, we want to reach urban grandparents, whatever it might be. So
Absolutely.
I don't know if you want to say any more about
Yeah, sure.
that distinction.
Yeah, what I meant was that absolutely is that language is a powerful indicator of identity and belonging. And we can use language to let people know that this message is intended for them. I think especially when we're trying to reach populations that might not be ourselves. Again, I don't speak Spanish. It wasn't for me, but I'm designing these messages all the time. And so I brought it up as an illustration of it was a light bulb moment for me of how strong these indicators are before we even get to the message of whether or not this is for me. We know imagery does it. We know word choice does it. We know again that physical language of is this printed in a language that feels like myself? Because it shows that this was intended for me. And our brains are processing things so quickly that if we can't hit them in that kind of system one, quick thinking, intuitive sense, if we don't hit them on some really basic level, they're just going to move past it. So I offered that as an illustration of it was a moment for me to remember that I've got to get out of my own experience, right? And that I'm often designing messages that aren't in my audience, right? And so I think language, as much as we can use language and imagery and word choice, natural word choice. Spanish is actually a great example of this. We had one of our translators was doing, I didn't know this. So she was doing a Spanish translation, but she was based in Spain. And so then one of our administrative assistants was Puerto Rican, and Spanish was her first language. And so I remember finding that out and saying, "Hey, could you tell me about this translation that our Spanish speaker is doing? Is this culturally appropriate for my audience?" And she laughed and she said, "Yeah, it's kind of like saying automobile versus car. And, it just wasn't language." She said, "It just sounds really stiff and formal. It's not how we would talk." So, this is what I mean about language is that I think it even goes deeper than the actual language that it's being in. It's which element of Spanish, which we've got a big Somali population here in Columbus. And so we do an awful lot of trying to reach Somali populations. And so trying to make sure things are not only in the language, but are culturally appropriate as well. So that's why I brought that up. Again, absolutely. I value every member of this society. That's why we're here, is because
Yeah.
we do all care. So again, to me, it's just a reminder that so many things are working before our message even starts to
Hmm.
land, right? And I just want to make sure that we're not doing anything that shuts them off before we even have the chance to reach them.
Can I share something real
Yeah.
quick that I just thought was funny is I used to work in youth tobacco prevention, and I did that in Iowa, and for a while they had a very edgy statewide youth tobacco prevention campaign. They had won national awards, all of these things. And I was speaking to I think we had gone like taken them to the legislature. I was speaking to an older gentleman. And he was saying, well, I just don't understand these ads. And I said, well, no offense. And I really was like, this is not intended to offend. I said, but you're not the target audience for these ads. And frankly, I'd be concerned if they, kind of grabbed you and caught you because, you know, 70-year-old, men in this area isn't who those ads were intended to reach. They were intended to reach middle school students. And I think that was a light bulb moment for him of, I think these ads are, ridiculous and they don't make any sense. And, kind of reframing it as, well, but you're not the audience for this message. The audience for this message is intended to connect with middle school and high school students, and they think these are great and they're talking about them. And, they're saying that they've seen them or that they've like, joked about them with a friend or whatever it might be. And I think at that point he was like, oh, that makes sense. So I just
Exactly.
thought I would share that. But I will hand it back to you and move along your slides here.
Yeah, sure. But it's a good clarification. It's an important one. So I appreciate the comment there. So, all right. Well, let's keep going then. And so, is authenticity so important? It's AI. The opposite of authenticity is artificial. And I think we are all highly aware now of the role of AI in our lives. And what I think what we really need to think about is our audience's perceptions of AI. You know, I myself, we're using it, and I'll talk about how, but I think there are times where, especially in public health communication, we need to think about maybe some drawbacks. And so, we're not going to go in depth into this. And so, my colleague Tracy did include on this, there's a QR code in the left corner of that. If you do need kind of a beginner crash course into AI, we do have one of those on our YouTube channel. So you can scan that, or if you go to YouTube and search for CIRTC underscore, you can find our channel there. And so, what we're going to talk about though with AI is what we're seeing here. So I really think that AI is going to be super useful in certain places for public health. I find it to be most useful in image generation. And so you can see some examples here of how in public health and especially in injury prevention, finding photos, finding visuals is almost impossible. And so we have started to use different AI tools to produce the imagery that we need to back up our campaigns. And so, we've used it for a variety of tasks over the years. And so you can actually see from left to right here the progression over the years of the AI generation. So that one over on the left, you can see has that kind of like airy, kind of airbrushed look that was so popular in AI a few years ago. The middle one is about the fact that if you look for safe lawn mowing photos, there's exactly one kind of person and one kind of house that has those kinds of photos. And so, women mow the lawn too. And so we were trying that out. You can see it's not perfect, but we got awfully close. And again, these were a few years ago. And so if you try these now, and some of them you can actually, we're generating a decent amount of photos actually out of AI now. And this one on the right was one we actually did use. That was out of ChatGPT. And so what we were able to do is one of our colleagues was able to use Adobe to just kind of put a sheen over the fireplace to make it look like it had doors. Because that was the one missing issue from this. It didn't have doors, and we couldn't get ChatGPT to put doors on it. So we were able to just take it into another program and add some doors and use it that way. But I will just say Nano Banana Pro, which is Google's image generator. I just tested out recently, and it is generating some really high quality images that I literally just used one last week. So I think it's okay to use AI for these types of things, but we do want to think about the ethical and other, just there's a lot of stuff around AI that I think is questionable. And so one thing that we're not using AI for anymore is writing captions, any type of text really. And that's because I'm sure like we can see now what's AI generated from a mile away. There's an example of this post up in here, this e-bike post. It's hard to see, but there's a line of 3 emoji followed by a bulleted list. That is a dead giveaway for a ChatGPT generated post. And I think we all know that. The other thing, which is sad for me, is the M dash. As a long time lover of the M dash, it's been my favorite punctuation since I was a kid. Yes, I have favorite punctuation. But it's now something that if you see the M dash, people are thinking, did you use ChatGPT to write this? And people want to know there's a human there. Yeah, we laugh about we're calling it disgraced punctuation. The colon is unfortunately on that list too. A title with a colon, which is public health, we've been using forever, forever. And so for us, there are times when, yes, that's the right thing to do, and we're still going to do it. But be aware of the fact that people are now seeing this as AI generated, and they want to know a human's behind it. So sometimes I'll not use that colon or figure something out, or I still use the M dash because again, sometimes it's just the right piece of punctuation. but be thoughtful about it, right? Like I sometimes will start with an AI generated post, but then I'm always going to want to, maybe tweak it a little bit to give it a little bit of a human touch. And then the last one I'm going to mention is the AI imagery. I don't know how many of you saw this Coke ad over the holidays. We included in this presentation because my colleague Tracy was sitting with her son, who's a Gen Zer, and his girlfriend, and they both had very strong reactions to this ad. They both were just upset because it said at the beginning it's AI generated, and both of them said they're taking jobs away from real creators. It doesn't even look consistent. Apparently, they're just the imagery was like the truck changed sizes just throughout the ad. But the thing that I'm mentioning here is that what they said is that Coke used to make them feel nostalgic, kind of heartwarming, emotional. Those were the Coke ads, the ones that pulled on your heartstrings. This ad, because they knew it had been generated by AI, they said that it couldn't be those things. It was the opposite of what Coke was going for. And so I think this was a real flop from Coke. And it just was really eye-opening for Tracy to hear her son's perspective of this goes against everything I know about Coca-Cola as a company. And so, just as public health professionals, we've got to keep in mind that AI can be good for some things, but again, if we go too far with it, we're going to lose what's important, and that's our connection to our communities. All right. So I'm going to fly through some of these here. So algorithm, I think, everybody's highly aware of how much the algorithms are controlling what we see. Every channel has a different algorithm. And I will be honest, these algorithms prioritize things that are not, I guess, maybe the strong suits for public health all the time. The types of things that drive engagement are often not what we're producing. And so it's really tough to get traction in the algorithm. And, it used to be that we could say, follow us, subscribe, those types of things, and you'd see our content. And that's not true anymore. I know that when I pull up Instagram or a different feed, in different places, half the stuff I'm seeing isn't accounts that I'm following. And so it can be really tough to get traction. But honestly, this is the controlling force right now is that algorithm. And so if you do want to try to get out there and maximize that content, the algorithms are all prioritizing video right now, especially ones that get engagement early. So if you are posting, go ahead and add a like and a comment to your post because that early engagement will help drive the algorithm. Okay. So it's looking at things like that. And actually, we can go to the next slide and I'll talk about that a little bit. This is the TikTok algorithm, roughly. And so you can see down there at the bottom left that once you push out that content, it's looking at the completion ratio, the shares, the comments, and the likes. It doesn't care that you are the first comment or the first like. So it's not taboo to like and comment on your own post, especially if it's adding a hashtag or adding a little comment, or you can use that comment to say something that maybe didn't make it into the caption, but it's okay to do that to kind of juice that algorithm in the very beginning to get that out, that engagement.
Katrina, I just want to say
Yeah.
I love that you shared that because I've been helping with CSN social media this week. And I'm like, I'll see something and I'll start to like it. And I'll be like, oh, wait, no, that's our own post. I feel weird to like our own post. And
It,
that never would have occurred to me that it's important to go like and
uh-huh.
share, reshare
Hmm.
your own posts to
Yep.
get the
Yep.
algorithm going. So
No, I think
thank
that's a
you.
common thing in public health. It's something I feel weird about too. So
Yeah.
it is something though, if you look at all the influencers, what's their number one thing? They put a comment on it, they're always the first. And so it's
Oh,
okay.
good
It's okay to
tip.
retweet yourself or repost yourself. This is
All
how the
right.
algorithm works.
And I'm just going to note for folks, we did put it in the chat, but we're getting right in the next couple minutes. We'll get to some time for questions and discussion as Katrina gets to the end of her few slides here in the next
Yep.
maybe 2 minutes, three
Yep.
minutes. All
Yep.
right.
Yep. We've got one more point here. I do
All
want to say
right.
one other thing about the algorithm, which is that I know in public health, this is what I do. I tend to post a lot of text with images or like images with text overlaid. Um, those don't get as much engagement. And so just try to remember what your goals are and how the algorithm works. And so if you're not getting clicks and likes on things, it doesn't necessarily mean that people don't find your content important. It just means that honestly, sometimes it's kind of weird to throw a like on an announcement about a car seat event or, something like that, right? Like I'm not somebody who always engages even with content that I find incredibly valuable and helpful. So there's a lot of reasons you might not be getting the likes and the shares, but the information sharing is still important. But just be aware of how that algorithm is working and how it might affect your goals. Okay, last one here is accuracy. And I know this is a huge topic for all of us because what we're going to talk about here is the mis and disinformation ecosystem. We like to think about accuracy as an ecosystem in the same way that disinformation is an ecosystem. So, we in public health have always been aware of that actual accuracy. What are the facts? What are the verified evidence-based interventions and messages that we can say? And so, yep, we got to stay there for sure. But I think in order to combat the spread of mis and disinformation, we need to figure out how to, again, create more of an ecosystem to protect our messaging. And so it's not just about those facts, it's also about trusted messengers. I think COVID showed very clearly public health is not always going to be a trusted messenger. And there's a lot of reasons for that. And that is what it is. And so if we are not the messenger, though, who is? I've worked in some communities where it might be, I grew up on a small farm town. Honestly, the local coach is about as trustworthy as anybody. And so it's more about thinking who can come with a message that is going to be received rather than them saying, I don't trust you or I don't like you, and therefore I'm not going to listen to you. So that's one piece of this ecosystem. Another one is active listening to our communities. How do they want this information? Where do they want it? And what do they need to know about the situation in order to feel informed or to take the action that you're trying to encourage? It's not just, again, being in those places. We're going to have to be listening to what they're saying and be able to respond to that on their terms and in ways that they can understand and use. And then the last piece is a rapid response plan. Sorry, well, there was just one more on that one. Just that, it does come up that people will put in comments. They'll, who knows, it just, that stuff comes up. And so for us, it's thinking about if we do get a comment or push back on something, it's about what are we going to do about it? What's our plan to respond to those types of things? And then who is empowered to do it? The process for doing it. I run a lot of our social media, but I am not empowered to simply respond to mis and disinfo. I need to run it through my manager, Tracy, right? So for us, it's about knowing what the process is when it comes up and knowing how to respond to it. All right, last slide here, just some takeaways. We really believe that, good communication requires knowing both ourselves, our role, our audience, our skills, what our needs are, what our goals are, but also what that audience needs from us. Where are they? What do they need it? What do they need? And then how do they need it? And then trying to bridge those gaps as best as we can. And then if we can't do it, figure out what's a plan B to still get that information out. My next one is to use AI thoughtfully. Again, I think we're all on the same page here that I think it's really great for some purposes. I'm using it for alt text and different types of things like that if I'm trying to generate alt text. But I really want to make sure that we're always remembering the humanity behind this and keeping us. We're here doing this work for a reason. And I think it matters to people. I think, again, in the age of artificial, authenticity is really, really going to rise. And then the last one here, I've said multiple times, which is really just matching your content approach with best practices to create those effective strategies. So, all right, I think that's it for me. So, oh, last thing. Oh, yeah. If you wanted to find more from us, from Tracy, Mian, and I, we have a bunch of projects that work on health com and health education, or health com education. So we have the Center for Injury Research, Translation, and Communication, CIRTC. So if you go to cirtc.org, you can find, we have different categories of resources, trainings, different materials you can find to help support your communications and outreach kind of activities. We also have a YouTube channel where we have just a bunch of trainings or things that have come up over the years that we've trained on. And so it's a list of videos We also have a Share My Screen series, which is a very practical, hands-on, getting into like Canva and PowerPoint and showing you how we actually do things. And then that last one is the podcast that was mentioned at the beginning, Communications Breakdown, where my co-host and I talk about what works and doesn't in health and science and communication. And you can find that anywhere that you listen to podcasts.
Oh my gosh, thank you so much. And I was not trying to rush you at the end. I just got a little click happy on my
That's
keyboard trying to go
okay. No
back and
worries
forth
at
between
all.
the
Yep,
slides
no
and the
worries.
chat. Um, also, I know Jenny shared your contact information in the chat so that folks can reach out to you. But we do have some time now, so I'm going to stop my share so that we can all see each other. Folks can feel free to turn their video on if they'd like, unmute if you have a question. And so we'd love to hear your questions for Katrina.
This is Jason in Nebraska. I got a question.
Yeah, Jason,
So,
I love it. Thank you.
the day and age of testing messaging and to the audience and all that, is that gone now with AI? And then also, it used to be public health, put something out at the sixth grade level and, all of these kind of things. Are those just not happening anymore, or where does that fit in all this?
So I'll take the first one. I will say one of the hardest parts for us has always been message testing simply because we don't have the funding. The way we've been running our programs, we've actually run out of a CDC grant for years. That's where we used to be an injury control research center, and that's what was supporting our work. And so we could do some message testing, but it was kind of few and far between. And so I can't speak for others, but I know that for us, we've lost a significant amount of funding and we've lost staff. And that is one of the things that unfortunately has gone. I still do what I call very informal testing. I know, I have a network of people. It could be in my office, it could be my family, my sister-in-law. I mean, I've got a bunch of nieces and nephews. And so I'm frequently trying to gauge from them one of my sisters-in-law is a stay-at-home mom. And so would this resonate with you as a stay-at-home mom? Another one's a working mom. Would this, or, trying to at least use some gut check or just some audience testing if you can't go through that formal process of truly getting true, kind of feedback and doing a more formal process. The other thing that you asked about, I think, was just pushing out, I'm sorry, can you rephrase that again? What was the second part?
Like grade level, the
Gotcha.
content of it.
No, we actually still are very much shooting for a lower grade level. Unfortunately, in child injury prevention, there's just some words that don't translate well. And, you know, it can get kind of, I'll use this example. Exposure is jargon in medication safety. For poison prevention, exposure has a specific technical meaning. And so when we're talking about poison prevention, and I'm talking about, you have to say it in, they swallow it, they put it up their nose. It's all that exposure means all of those things at once, right? And so what happens is we have to balance that lower grade level with how do we then have a message that's still, unfortunately, my stakeholders are all doctors, and they want to talk a certain way. And so I can remember having to discuss an alternative for esophagus and being told food tube might be an option, and me going, I can't use food tube. So for us, it's really a balance. We are always shooting for the lowest grade level we can do. If that is right for our audience, for our public facing stuff, sure. But we've got another program that serves medical residents, and you've got to write that in a way, you've got to be using the jargon there. Now, what we're training them to do is take that jargon and speak in ways that others will understand. But in order for them to understand it first, we've got to use that jargon. So, as a public health professional, my outward facing stuff, oh, yeah, definitely we're trying to keep that as low as possible, stick to one message, plain language, health literacy, all the things that we're used to. So, again, audience dependent, but at least for us, for our outward facing stuff, we're still absolutely on that.
And I just wanted to note that Bailey in the chat said she was guessing that she found the research that you referred to earlier, the American
Yes.
Social Media Use 2025 from the Pew Research Center.
Yes. Yes.
Great.
Yeah, and they're actually there's if you go back, they will break down they've got stuff over the years that will go really in depth with different audiences, especially if you're trying to reach teens. They've got some really, really great stuff on where teens are, even breaking down some of the demographics within the teens, gender and sex, some of the other things. And so we will really look at that to determine, we're trying to decide whether we're not going to stay on certain channels or expand to certain channels. And so this is the first place we go is our audience even on this channel? So,
Mm-hmm.
yeah.
Other questions? Oh, Janelle has her hand raised.
Yeah, wanted to jump in since you brought up the topic of the research with Pew Research, and I was wondering, I mean, that has a lot of great data on, demographics of who uses what social media platforms. I wondered if you'd seen things that get more into how people use them for different things, because just because someone's on YouTube a lot doesn't mean that's how they want to get information from their health department or that sort of thing. So,
Yeah.
how we take that into account.
Yeah, for sure. So they do actually get into some of that too. Um, Pew will get into that. Now, it is more news focused, is like where are you going for information? Kaiser Family Foundation usually has some information about where people go for health seeking information. The other one is NORC out of in Chicago. Oh gosh, what it's called? Something recent. It's NORC, NORC. They do a lot of work with AP and different types of polling agencies to also determine where people are going for different types of information. So I will frequently go to those types of organizations to figure out that kind of thing. I will also say though that there is just a lot of general research out there. Just getting into PubMed or Google Scholar or something else and start seeing it might not be in our exact field all the time, but I'm seeing a lot of things. We don't do intentional injury. We also don't do like tobacco and things, and it's not the same. But what we've found is that there's usually little takeaways that we can say like, okay, well, teens are not going, I think it's something like half of teens are now going to TikTok to get their news, right? And like that's actually Pew data. I'm pretty sure I saw that in Pew. And so, right, if you're trying to reach teens, sure, but we're not necessarily going straight for the teens themselves. We're again more right, trying to reach working professionals. And so I don't know that TikTok is the right place for us because I don't think that most working professionals are going to TikTok for that information. So yeah, Kaiser Family Foundation, NORC at Chicago. Again, Pew, if you keep going back in Pew, they actually have way more than just that social media data.
And Katrina, I think sort of tying your last 2 points together with your point about jargon, Laura just shared in a comment about, again, sort of thinking about audience that the word exposure might have different meanings and or like the word surveillance means one thing to public health folks and another thing to law enforcement folks. And so I think, really your point about knowing your audience
Yeah,
and also when possible, I know it's difficult with funding. We talk a lot with our folks in the CSLC about really trying early on in their work on whatever their topic might be to bring in folks that have connection or have their own experience with this context so that they can
absolutely.
share with you your messaging. I've shared a story before about some tobacco messaging that we did that went awry because we didn't quite know the audience as well as we should have. It was a great teaching moment for my youth tobacco prevention group at the time. But I think having folks that are, able to give some of that input or that you're able to sort of look at that crosswalk of the language, I imagine is really helpful.
Yeah. And one of the benefits of being on the team I'm on is that we all are coming, we're all in similar situations, but we all are coming from kind of different walks of life. And so to speak, I grew up on a farm in rural Ohio. And so, but it's really helpful because I'm in Ohio and we do messaging for rural areas. And so I'm able to say, like, it's just not going to land for that. Like, that's just not going to work. So when we did farm safety, I was able to come in with a little bit of expertise and say, like, I just don't think that's going to work for the people I know. So again, it's really tough. I really wish that we could message test and focus group and do all the things,
Mhm.
but we just don't have the capacity. So there were a couple of other things I saw in the chat that I wanted to bring
Yeah,
up.
please.
And so I see using AI to generate alt text. I want to make a note about that. I have figured out how to prompt AI to write alt text that I want. What AI thinks is alt text is not always going to be right from a public health perspective. So I have noticed that it will give a description rather than the verbatim text. In many cases, it'll say, like, if I'm doing something on like carbon monoxide safety, and I say, ChatGPT, give me alt text for this, it'll say a graphic describing carbon monoxide safety that shows locations throughout the house. That's not specific enough for me. If that image doesn't come through, the meaning of that image is, well, there's probably some text on it, but it's also where those little carbon monoxide detectors were placed in that image was very specific. We put them in the places they were supposed to go to back up our message. And so I now know how to use AI to in a prompt. So I'll say, give me the alt text for this with a simple description and verbatim text. Because otherwise you kind of have to prompt it a bunch of times. And we really do try to be thoughtful with AI because, I mean, we know what it's doing to the earth. So I just wanted to make a little comment about that you do need to watch out for the AI generated alt text. So.
Yeah, thank you very much. Um, well, I think we're gonna, if folks have any last comments or thoughts, please feel free to share them in the chat. But I wanted to make sure that we had time just to share a couple additional things. So don't go yet. Don't turn that dial yet. So we do have a few resources from CSN that are linked here as far as helping improve prevention messaging. I think it was a webinar, I think it was a STA that we had done on youth voice and mental health messaging. Also, a nice resource is the communication toolkit from the University of North Dakota Center for Rural Health. And then I had put in here, I had listened in on a webinar from the PTTC that was called Say It So You Can Hear It, Prevention Messaging That Resonates. It actually really dovetailed nicely with a lot of the ways of thinking about this that Katrina shared. They did say that they would be posting the recording of that webinar on their site. I think it's not there yet, but hopefully once we get all the materials out and folks click on it, if you're interested in a little bit more information on this topic, a couple of our colleagues from EDC were on that, and it was a nice webinar. I'm so excited to share our save the date that we are getting ready for cohort 3 of our current iteration of our Children's Safety Learning Collaborative. We will have 5 topic areas that you can choose from to participate in: bullying prevention, motor vehicle traffic safety, suicide and self-harm prevention, sudden unexpected infant death prevention, and drowning prevention. And so we hope that if you are not already on and you're interested, we're going to put the link in the chat, and you can go to our website and find out a little bit more. The applications will be opening with this summer. If you're already participating, we hope you'll be thinking about continuing to participate and sharing with your colleagues. It really is a nice opportunity to get some additional TA and some quality improvement tools, but also just to connect with your peers that are doing similar work across the country. I want to say a huge thank you to Katrina for accepting our request to come and present and talk to us about this, and all the time and energy and thoughtfulness that she put into this. So thank you for being here. I want to thank all of you for being here and participating. Always a note to check us out on social media. We've got all our different social media things listed here. And then most importantly, not most importantly, but also important, we'd love for you to fill out our evaluation. There's a QR code here. We're going to also put a link in the chat. It's really important to us to make sure that we're kind of hitting the mark with things, that you're getting what you need out of our events. And if you have ideas for future topics, future events, ways that we can do things better, we also always would like to hear from you. So I'm going to leave this up for just another minute and hope that you'll take the last minute or two here to navigate over to that and fill out the evaluation. And again, I just want to say thanks so much to everybody for attending and hope you have a wonderful rest of your day.